Restrictions into shoulder elevation may also respond well to some self-release, particularly through the latissimus, and this is best done using a foam roller. So basically lying on the side, that area under the arm and on the upper part of the side of the rib cage in contact with the roller, basically using the side flexion of the pelvis to roll the body over the roller and focusing on those areas that feel particularly tight and tender. Form some contract relax stretches into shoulder elevation. This can be done using a TRX. So basically moving into end range until you feel that restriction, making sure that you're not compensating with lumbar extension, so keeping the back nice and straight. And then from there, pushing forward. All right, so if the strap wasn't there, the arm would be moving in this direction. So pushing out against the resistance of the strap, holding for 5 to 10 seconds, taking a breath in and exhaling as you relax, and basically move the body forwards to take the arm further overhead. And then you would perform the same movement, pushing in, holding 5 to 10 seconds, relax, move forward further into the range. Shoulder elevation may also respond well to some isometric holds at end range, particularly if there's a big difference between active range and passive range. There may be some control or strength issues within that restricted range. So one way we can perform this is with the use of a pole. So basically holding onto the pole, using the opposite hand to guide the arm into flexion, taking that to end range, and then taking the pole away and attempting to hold the arm in that position. So assisting with the concentric aspect of the movement, the other hand, and then taking the pole away and attempting to hold the arm in that position. So shoulder flexion restrictions may also respond well to some temporary repositioning of the joint, and this is usually done with a band, a thick band, or a rigid strap. So basically placing that around the front of the shoulder. The most common direction that we apply this technique is an anterior-posterior glide, so moving the top of the arm backwards in the shoulder joint. From there, basically moving forward so that you're getting that backwards pull, and then maintaining that there, lifting the arms up into elevation. Someone who responds well to a distraction force into elevation, we can perform that type of movement using a tight band, or preferably a rigid strap. TRX works really well. Basically setting up so that we're leaning away from the strap and essentially creating a type of sensation where the arm is basically being pulled away from the shoulder joint, and then maintaining that traction force, leaning the hips back to bring the arm into that relative elevation. So someone responds well to a compression force into shoulder elevation. We can replicate this using the yoga movement, the downward facing dog. So basically in a push-up position, from here, moving the hips back and up to bring the shoulder into elevation while maintaining that compression force. Co-contraction techniques to improve our shoulder elevation range of movement. If someone responds well to an abduction or horizontal abduction movement, we can perform that with a band. So gripping the band fairly close together, pulling the band apart, and then maintaining that contraction while we bring the arms up to the front. Someone responds well to internal rotation, basically starting with the palms facing down, flip the band over, and from there turn the palms inwards, and then holding that internal rotation contraction, lifting up to the front. Someone responds well to external rotation. Start with the palms facing up, flip the band around and rotate outwards, maintaining that external rotation contraction, lift both arms up to the front. And if someone responds well to adduction or horizontal adduction, we can use a pole or even a small foam roller and basically pulling in, trying to compress the pole, maintaining that adduction contraction and lifting the arms up to the front. So we can perform a symptom modification procedure to ascertain the most appropriate mobility intervention for the specific client in regards to their shoulder mobility. And we'll take shoulder flexion as an example. So if I can get you just to keep your elbow straight, lift both arms up to the front, going up as high as you can. Good. And then come back down. All right, so I'm going to get you to do it again. This time I'm going to apply a little bit of compression. So as you lift the arms up overhead, so lifting up, as you come past 90 degrees and go up to the top of the range, basically driving the arm down in towards the shoulder joint, okay? And then come back down. So applying a long axis compression force into the glenohumeral joint. How does that feel?
The same.
The same, yep. Next we're going to try some distraction. So I'll get you to lift up again, and then just applying a little bit of gentle long axis traction force, pulling the arm up whilst providing some stability to the scapula. So basically stabilizing the scapula and pulling up on the arm. How did that feel? Easier, good. Another thing we can try is some irradiation. So I'll get you to make a nice tight fist. All right, keep your fist as tight as possible and lifting the arms up to the front. Good. And then come back down. Any change there?
A bit easier.
A little bit easier. All right, sometimes using that strong grip will make a significant change to their mobility, and if that's the case, we may use that as a mobility tool. So we just have them literally practicing that movement while making a tight fist. Would also maybe look at their grip strength and see if there's any significant lack of strength, either compared to normative data or comparing side to side. If there was a restriction in shoulder mobility on one side and there was some decreased grip strength on that same side, that might be an indication to focus on that grip strength. We might also have them or we might cue them to grip a little more strongly when they're performing overhead pressing, for example. We can also use some co-contraction techniques. We'll go through 4 different co-contraction techniques here, including external rotation, internal rotation, abduction and adduction. So first of all, I'm going to get you to keep your elbow straight. I'm going to try and rotate the arm inwards in this direction. I want you to actually try and resist me. Okay, so as I'm rotating in, I want you to try and rotate outwards. Other way, yep. And then holding that contraction there, lifting the arm up. Good. And then come back down. All right, how does that feel? Easier? Okay. Now we're going to do internal rotation, so I'm going to be trying to rotate your arm outwards. I want you again to try and match my resistance. Good. Holding that contraction on, lifting both arms up to the front. Back down. How does that feel?
Harder.
Bit harder? Good. And then this time I'm going to be pushing the arm inwards, going this way, maintaining that contraction, lifting up. Down. How does that feel? Easier. Good. And then pushing inwards. So I'm pulling out and just matching my resistance there. And back down. How does that feel? Harder. Okay. So again, we can use that as a self-mobilization with movement technique or movement with activation. We can use that as part of their mobility program and also as part of their active warm-up.